So I didn't realize that it's National Endometriosis Awareness Month in March. So we need to put the word out there about what it is.
Definitely. We want to optimize women's care because it's a debilitating disease that affects 5 million women alone in the United States, usually women that are in their 30s or 40s.
I have to admit, I'm actually one of those numbers that has been affected by it. So for those people who may not know what it is, when we say endometriosis, what does that mean?
Endometriosis is tissue that's normally on the inside of the uterus that gets to the outside, and it can cycle like your normal menstrual tissue and cause a lot of different issues such as pain or infertility.
So if you are having some unusual or abnormal pain, that could be a sign, but there's also lots of other symptoms as well, that, like we're seeing here on the screen.
Absolutely. Your biggest things are pain. You may have pain with your periods, as far as having pain that's focused around your periods, and sometimes you can have pain outside the periods. Some women will struggle with infertility, and endometriosis is typically diagnosed with women that are going through infertility workups to try to determine why they're not able to have children. Other women may experience problems with constipation or diarrhea, and some women may have dyspareunia, which is pain with their intercourse as well.
Yeah, so let's talk causes. How does that lining work its way, I guess, to the outside of your uterus and get where it's not supposed to be?
Well, the cause really is unknown. It's not truly understood, but the leading theory is that you have blood that flows backwards out of the inner cavity of the uterus through the fallopian tubes and then gets inside of the pelvis. And once it's inside of the pelvis, it's trapped. So it will cycle like normal tissue and has nowhere to go and can cause a lot of scarring and pain.
Okay. Yeah, I know it's not fun. So, but there is hope out there for people who may be experiencing this, because there are some treatment options.
Absolutely. So the main thing is that you want to focus on the pain control. So things like ibuprofen or non-steroidals over the counter can be very helpful for managing the pain. Other things, we can use hormonal therapy like birth control pills or other different types of medication. In some cases, you may need to go to surgery options to further evaluate the pain. And the definitive way to treat it would be with hysterectomy, which is typically a last option.
Yeah, because if you are wanting to have a family, you'd probably want to go those other routes first. But
absolutely.
But also the surgery, it wasn't that terrible. My doctor actually described it as being like clearing out a bunch of cobwebs.
Absolutely, absolutely, because it can be quite a bit of scar tissue.
Yes. Does that come back? Once you have the surgery and kind of clean it all up in there, what are the chances of it, like, reoccurring?
It really depends on the severity of endometriosis to start with. There is that likelihood that scar tissue can come back because every time that you do surgery, you have the potential for more scar tissue to form. But fortunately, in more cases than not, you're able to successfully get to a point where women are pain-free for a relatively good amount of time.
Yeah, okay. When is the point you get to when you think, I need to go see a doctor?
If you have any of those signs or symptoms, that is the important time to really talk to your physician, because the challenge in managing this is getting to discovering that you do have an issue right away. And once you have that issue, it can be lifestyle altering for a lot of people. So surrounding yourself with professionals that are able to support you, diagnose what the problem is, it's going to go a long way towards being able to benefit you.
Yeah. How does that diagnosis come to be, though? Is it a blood test? How do you know without going in that it's endometriosis? Is there a way to figure it out?
Actually, no, not as far as the blood work, but the definitive diagnosis is going to be through laparoscopy, where you look inside with the camera and you physically see the endometriosis and optimally taking biopsies of the tissue to diagnose it.
Okay. Lots of great information. We appreciate you coming and sharing that with us, educating us on endometriosis and National Endometriosis Awareness Month. If you need any more information, there's a look at our friends at Christie Clinic's website, which we will connect you with after today's show. Thank you so much.
Thank you, Heather.